I don't think we were prepared for just how many people would die.
I was admitted on the 11th of August 2020. It was for 52 days, of which is 46 of those days I was in ICU.
One day, a family can be sitting together and having just an innocent Sunday lunch, and 2 weeks later, 4 or 5 of them would be dead. If the public saw that, not just saw the numbers, they would see that they don't want to be in a situation lying on a ventilator alone without their families.
There is no chance at all left that we would ever get rid of this virus. It'll be with us and it'll remain with us. And that basically means that we all will become infected. And our best way of making this transition into what we call endemic situation, where the virus will be with us and will be infecting us, the best way to cushion that transition is by getting vaccinated.
Vaccination is not only something you do for yourself, it is a public health intervention.
I think it's very important for us to set the example when it comes to taking the vaccine.
What are we saying to the public if we as the health workers do not get vaccinated?
We need to be the ones at the front asking for the vaccine at the first available opportunity.
Our students have rolled up their sleeves and assisted both the public and private sector in terms of rolling out vaccination. We've now vaccinated 70% of our undergraduate students.
A lot of people are afraid about the long-term side effects of the vaccine. They don't know what it might do to your body.
I think people are still afraid because of the many things that they read, and I can understand it. People also don't blindly trust governments or even the medical fraternity anymore.
Misinformation that is so rampant not only damages vaccine uptake, but it also damages our togetherness as an academic and clinical community.
It didn't all start only in January 2020. The work on these vaccines started decades ago. They were developed for HIV and other diseases, and it was relatively quick to then plug the new virus into these vaccines.
More than 4 billion people worldwide have already been vaccinated, and the safety has been proven without a doubt. We know that it is also very effective in preventing hospitalization and death. It also prevents new infections to up to 50% of people.
Taking the vaccine will save other lives.
Can you please help your neighbor? It means that if you're vaccinated, chances that he or she is gonna die are minimal.
Speak to your doctors so that you can receive the correct and accurate information and make that informed decision.
It has the potential of opening up the society again, giving us freedom to again go to theatres, go to sports events, opening up the economy, travelling.
We've eradicated smallpox. We are at the point of eradicating polio, hepatitis B, mumps, rubella, tetanus, diphtheria, and COVID will be another one.
I encourage our families, our friends, our church and religious leaders to take up the plight. I yearn for the days when we can hug each other, and that will only happen when we are all vaccinated.
For the health workers, they are our warriors. Let's allow them to do what God ordained them to do.
I've dedicated my life to making people better and to watch people die when they didn't have to die, that we could do something. If I could just close my eyes and wish that everybody gets vaccinated, we won't be in this position.
Today, it's a miracle for me to be alive. But then there are also other people, many people, who didn't have a chance to live.